sometimes what we really need help getting up to speed with is at the doctor's office. Our next guest is here to help us prepare, make the most of our doctor's appointments in 2026. Joining us now is Dr. Sarah Nosal. She's the president of the American Academy of Family Physicians. Doctor, good to see you again. Thanks for being with us. So let's start with the basics. You say you have to see your primary care physician every year.
I really want to see you every year. I want to have the opportunity to catch the little things before they become big things. I want to make sure we're reviewing, are you updated on your vaccines? Have we gotten all your cancer screenings in? And also, when I know you over time, I know what your normal is. And so if you say something feels right, like not how I usually feel, I'm off, I know that you don't seem like yourself, and together we can collaborate and investigate and figure out what's going on.
That all makes sense. And I know you say writing down a list of your prescriptions, which can be a pain, but like really get it in order before you walk in that door.
I would love you to even bring a bag of all of your prescriptions, supplements, herbs, tinctures, and teas, anything you're putting on your body or taking in your body. Please bring those in. It makes a huge difference in my ability to know if there might be interactions.
And we have on the screen, like thinking ahead about any symptoms you might be feeling, any questions, because I've had that moment where you're like, oh, I had a question, but I can't remember. Write them down.
Absolutely. So bring me your bag of meds and your list of what's going on. And at the top of that list, what's your most concerning complaint? Or if you've had symptoms along the way, keep that list up to date in your phone. Bring it in. Show it to me at the start of the visit. I want to prioritize your priorities and also know if there are any red flags.
A lot of us now have doctors that have portals or healthcare systems that have these portals, which can be great. They also can be really frustrating, quite frankly. How would you advise people to best navigate and use those portals?
Know that when you're messaging me, you're probably going to get a great member of my team who wants to help meet your needs. They're going to help you figure out, should you come in for a visit? Is this just a request for a medicine that they're going to make sure that I complete for you? Or is there some need that is new that is maybe more urgent and we need to address or figure out connecting you to another bit of care?
Yeah, and I don't know if this is unique to New York City because I live in this area, but we were talking during the commercial, coordinating between doctors in different systems with different portals and different records keeping can be really frustrating as a patient. Any advice?
Your doctors are getting better at this. So I'm able electronically to even touch multiple different hospital systems, even those that don't have the same electronic health record. And your family doc can then take all of those records and coordinate that with you. Make sure that you've been able to review the recommendations of not just your family doc, but all of the specialists and help guide a health plan that incorporates all of that information.
Okay, that's positive that we're moving in the right direction. Okay. Although in my experience, there's still some glitches there. Some insurance companies want you to talk to your primary care person before you can see a specialist. And that can also be like a long wait then to get in with somebody. Is there any advice on how to kind of make that faster?
So if it's a complaint that you and I have talked about before in the office, often I will just renew a referral if you have that. We already know you need specialty care. But if you have a new symptom, please come in and see your family doc. We want to make sure, one, that it's not something that needs more urgently to be addressed, and two, that you're going to even see the right specialist. And so we're going to help make sure if that needs to happen, or can I just provide the care for you right in my office?
And if you don't have a lot of time for a visit, are there ways to get around? I mean, is it okay to just send you a note on the portal about a medical question or do a phone call?
It's definitely a place to start, is a message on the portal. More and more places are able to do telehealth visits, but I would tell you a PCP, a family doc who knows your history, is going to help you make the best next choice for your care.
Like as opposed to just going to a random, I don't know, those services where, right, exactly.
Who doesn't know your meds, doesn't know your history, doesn't know your family history, or what risks to look out for.
Dr. Sarah Nosal, so great to have you with us. Thank you so much. A lot of great tips.